Welcome to the Defeating Epilepsy Foundation YouTube channel. In this presentation, we will discuss what Unverricht-Lundborg disease is, the history of Unverricht-Lundborg disease, its causes, signs and symptoms, diagnosis, treatment, and prognosis. Make sure to like our videos and subscribe to our YouTube channel. Click on the bell to be notified of future videos. Please click on our donate link in the description section below and donate today. Your donation helps us to make a difference for those battling epilepsy. We appreciate your support. Unverricht-Lundborg disease is a type of progressive myoclonus epilepsy. While rare, it is the most common single cause of progressive myoclonic epilepsy. Unverricht-Lundborg disease has a late childhood to early adolescent onset, with a peak at 12 to 13 years of age. Unverricht-Lundborg disease was first described in 1891 in Estonia by H. Unverricht and in 1903 in Sweden by H. Lundborg. While there are global cases, it originally separated into Baltic myoclonus in patients from Finland and Mediterranean myoclonus in Southern European and North African patients. Together, they were unified into Unverricht-Lundborg disease in 1989 due to similar clinical presentations. It was confirmed that they were mutations of the same gene on chromosome 21q22.3. Unverricht-Lundborg disease is caused by any 10 recessively inherited mutations on the cystatin B gene on chromosome 21q22.3. The most common mutation is the expansion mutation, in which more triplets are present than in a healthy gene. This mutation is present in approximately 90% of the disease alleles. The other 9 mutations are a result in amino acid changes, altering how the cystatin B gene interacts with other molecules and causing loss of function. People with Unverricht-Lundborg disease have morning myoclonic jerks and limb ataxia and show polyspike wave complexes on EEGs. Some patients may also have difficulty articulating speech and attention tremor, which is involuntary rhythmic shaking that worsens during movement, as well as depression and a mild decline in intellectual functioning. Unverricht-Lundborg disease is diagnosed by myoclonus with ataxia and no major cognitive impairment, and thus should be confirmed by polyspike waves on EEG and genetic testing for the recessively inherited mutations on chromosome 21q22.3. Medications used to treat Unverricht-Lundborg disease are sodium valproate, clonazepam, levetiracetam, and topiramate. Options such as the ketogenic diet can be used to reduce seizure activity. People who are suffering from Unverricht-Lundborg disease should avoid taking phenytoin, carbamazepine, and vigabatrin due to a potential increase in making the symptoms of myoclonics and ataxia worse. Prognosis depends entirely on the severity of the condition. Many people with Unverricht-Lundborg disease can lead normal and productive lives. Others will be severely disabled and rely on caregivers for help with daily needs. Unverricht-Lundborg disease does have a limited progression, meaning that about 5 to 10 years after onset, it will stabilize and the patient should not deteriorate any further if seizures are well managed with medication. In conclusion, Unverricht-Lundborg disease is a type of progressive myoclonus epilepsy. While rare, it is the most common single cause of progressive myoclonic epilepsy. Unverricht-Lundborg disease is caused by any 10 recessively inherited mutations on the cystatin B gene on chromosome 21q22.3. Anticonvulsant medication can help to control seizures brought on by Unverricht-Lundborg disease. Depending on the severity of the condition, some people can live normal, productive lives, while others are disabled and are in need of assistance from a caregiver. To learn more about Unverricht-Lundborg disease, please check out the resources used in the presentation today. Please like and subscribe to our channel and follow us on our social media pages. Subscribe to our bi-weekly newsletter for our latest articles and more information. We would love to hear from you. Leave a comment below or email us at info@defeatingepilepsy.org. Thank you for your support, and together we will defeat epilepsy. Check out our other great videos and subscribe today. You have the power to defeat epilepsy.